Okay, I suppose the most important thing, the message that should be going out here from tonight should be that if people need help, it's there. But no one should have to depend on luck for services. But unfortunately, in some cases, that's the situation. Location shouldn't matter between the difference between care and no care. But unfortunately, that's the situation in parts of our country. 2 weeks ago, in my constituency, there was 3 suicides, one after the other. 3 young people in one parish in part of my constituency. So you can imagine the impact that had on that area. I asked you, Minister, tonight, if it happened, there was 3 separate accidents on the road, what would happen? Well, there'd be discussion, there'd be extra services and so on. I don't know of any extra services that have been put into my area following these tragedies. And that's part of the difficulty. One person in my constituency who's up here tonight, who's in the public gallery, has been told by the HSE that there's no funds to run a crisis training courses. So she went out and got her own funding, her own venue and facilitators, and now has been told by the HSE that nobody is allowed to self-fund to provide these services. Now, someone makes sense out of that. And Minister, if you like, I'll introduce you to the person afterwards, or I'll write to you in relation to the case. It doesn't make any sense in relation. So as a country, I think we'll all accept that we greatly improved over the last number of years, and we've had the discussion here tonight in relation to what needs to be done. So I can't understand again when people show the bravery, and it is bravery in some cases, that they go down to the A&E to look for services. But the problem then is that the services aren't there. It's not suitable in many cases. And what we're saying is that there needs to be properly trained staff and so on. So am I on my own here tonight to find that it's incredible that at present there's no statewide 24/7 crisis intervention service for people in emergency health care? And that's the big question. So sad, disappointing, the debate here tonight. An awful element being brought in by Regina Doherty. But at the end of the day, what we need to talk about tonight is that we're going to do things differently, that there's a greater awareness, that there's going to be more resources, and that we're going to do things better. And surely if we can agree on that, regardless of motions or anything else, that will be a good step forward.